Well, joining us now from Tel Aviv to help us understand Israel's success and what the world can learn from it is Dr. Ron Bollister. He's Director of Innovation at Quali. It's Israel's largest health services organization. Ron, thanks so much for being here. Israel is the envy of the world at the moment with the vaccination campaign that's been well underway. What are the early conclusions from it? Why have you been so good at inoculating so many people so quickly?
I think that the first point that we have to take into account is it's not really a fair comparison. Israel is a small, condensed country and fairly young. And, vaccinating all of the elderly in Israel is a very small dent in the international supply chain. And so we have to take that into account when we make comparisons to countries in the size of the US, Germany, or the UK. But after that point, we do have to acknowledge the fact that it was quite an astounding a process in which we have been able to vaccinate over 40% of our population by now and reaching almost 90% of our elderly. And this does already show a substantial impact on our morbidity patterns. And what we see that despite the fact that we are in our third and very aggressive wave of COVID-19 these very days, we still see a marked decline in the rates of infection and more importantly of severe disease among the population that is 60 years and older, which were the first ones to get vaccinated about a month and a half ago. And now we see the fruits of that effort when over 75% of our population above the age of 60 have now reached the point in which they have more than a week after the second dose, and therefore they are fully protected.
It's an incredible feat. When do you anticipate that you will reach 75% immunity across the country?
Oh, that would take time. That would take time. So within, I think, about 3 weeks or so, it will be about 40% when you talk about all age groups. But we have to take into account that 30% of the population is below the age of 16 and therefore will not be vaccinated anyway. So, if we vaccinate everyone that is eligible, we will reach the mark of 70%. But getting to 70% from 40% is going to be exceedingly difficult. We need to be a little bit more realistic. I'll be very happy if we reach 50, 60%.
I appreciate you saying that it's not, that it's not apples to apples comparison between Israel and other countries or other states. But I got to tell you, I got to push back on that a little bit, because if we think about it here in the United States, there are some states that are the size of Israel that don't have results even anywhere close to this. What are the lessons that we can take away from what you've done in Israel and how we could be doing this differently in other parts of the world?
So some of this is setting specific, really setting specific, because, in Israel, there's universal healthcare. Everybody is insured and everybody's getting all of their daily healthcare services from 4 health maintenance organizations, sick funds as they're called here, which are really strong, logistically very sound organizations that are used to outreach and to a lot of professional care within the community setting outside of the inpatient setting, and with a lot of great relationship between the GPs and the patients on the daily basis. So getting the one step ahead from that stepping stone and getting to a point in which we create quickly vaccination clinics is easier. The second point that we have in a setting which is different is that we are fully digitized, and we've been fully digitized for over 20 years.
Wow.
And so, the patient comes into the vaccination clinic, he either gives his ID card or just his member card, and immediately all of his data is on the computer. We know what allergies he's having. We know everything about his background morbidity. And within a matter of seconds, he's already sitting down, getting the vaccine, and out the door. So it's very different when you have to retake all of the history during the visit to the vaccination clinic.
Yeah, it's a lot different than here in the United States. I mean, electronic medical records, universal health care, and widespread availability and adoption and accessibility of technology, not things we have at all here in the United States in many parts. I do wonder about the variants, Doctor, how you're thinking about the variants and to what extent they've shown up in Israel, and to what extent they have proven that they are or are not, the vaccines are or are not resilient to them.
So the variants are a serious wild card. It's a complete game changer. What we've seen in the last few weeks is how the UK variant, the B117 variant, has become from a 10% of the new cases to over 70% of the new cases. So it's taken complete dominance over the infection in the country. And that has caused a lot of trouble with an increase in infectivity that made us be very hesitant about stopping our recent lockdown. So we were in pretty dire shape because it is quite infective, and you can see the impact on overall efforts to contain the illness. So thank God for the vaccination campaign. Had we been going through this surge of morbidity with the UK variant without the vaccines already in place for a month and a half, it would have been pretty ugly, as our hospitals are already has almost reached their maximal capacity, and only now are beginning to see the decline. So this is about the UK variant. For everything that we know and for everything we've seen in the literature until now and our practical insights from the practice, the Pfizer vaccine seems to be effective against the UK variant. So these are great news. What will happen with the other variants is a question mark.
Yeah, it remains to be seen. Israel last week, doctor, sent 5,000 vaccine doses to Palestinians in the West Bank, along with 10,000 doses of the Sputnik V vaccine donated by Russia. When are you and Israel going to shift more focus to help those surrounding areas?
So, it all is also dependent on their willingness to receive. Again, I'm not involved in all of these efforts, so I know very little about them. But from what I hear, there were offers before to provide vaccines to the population. There was some reluctance on the other side to receive what seems to be like aid from Israel. And I'm glad that they've been willing to receive this current vaccine shipment, and I hope more will follow. I'm the chairman of the Israeli National Experts Advisory Team on COVID-19 response, and we have, provided a very clear recommendation that we should focus efforts on vaccinating the Palestinian population to the best extent possible. These are epidemiologically single. The movement of viruses do not know the borders, and we should be doing our best efforts on that domain as well. I'm sure this is part of the government's process.
Dr. Ran Balisser, Chief Innovation Officer of Quali, thank you so much for your time, Doctor. We really appreciate you taking the time. Incredible speed of vaccination in Israel.